Hello, dear students. I'm Medvedeva Anna Valentinovna. I am the assistant of professor in the pathological anatomy department of Saratov State Medical University, and today I will describe you lecture about formulation of clinical and anatomical diagnosis. We will discuss this lecture as formulation of diagnosis of several cases. And first case, situation. A 60-year-old man had become worried about weak abdominal pain and backache. He had been experiencing those symptoms for about 6 months. On examination, his doctor revealed a large pulsating abdominal mass. An abdominal aortic aneurysm was diagnosed and he was referred to a hospital. Soon he died due to aneurysm rupture. Look, in this picture you can see the result of autopsy. We see changes in the abdominal part of aorta. What is the likely cause of this patient aneurysm? Think, please. In this picture we see result the section of abdominal part of aorta. We see cause of formation of this aneurysm. Describe the aorta on the gross section. In this picture, we can see histological changes in the large vessels, in the aorta and large vessels, formation of plaques, growth of connective tissue, and calcification. The volume of those arteries is decreased. We can see some complications of this disease. You can see changes in the small intestine as a gangrene, in the lower extremities as a gangrene too, necrosis in the heart, and hemorrhages in the brain. Which other complications may occur in this disease? And please state the correct anatomical diagnosis. In the left side, you can see main pathological processes and diseases which we see in this case. Aortic aneurysm with rupture, first, atherosclerosis in the aorta, coronary and cerebral arteries atherosclerosis, acute post-hemorrhagic anemia, and benign prostatic hyperplasia. You must state those processes to the four main rubrics of diagnosis: underlying disease or main disease, background disease, complications, and concomitant disease. Please state the correct diagnosis and discuss this situation in the practical lessons. The next case. Situation. Case number 2. In the man of 59 years, during autopsy in the lumen of interventricular branch of the left coronary artery of heart, there are found solid masses of gray-red color, which are attached to the vessel wall in the area of plaque. In frontal wall of left ventricle, we see a cardiac muscle pale, irregular pretoric. At histological examination in the frontal wall, cardiomyocytes are homogeneous and pink without nuclei. What can we see in the autopsy? Which process takes place in the myocardium? In the left side, you can see gross section, anatomical picture of changes in the myocardium. In the left side, we see histological examination of cardiomyocytes without nuclei. Which state of this process? In this picture, you can see anatomical picture of coronary vessel. On the section, what can we see? Which reason of this process? In this slide, you can see immediate cause of death, changes in the lungs and in the brain. What this? Which pathological process? And please stay the correct diagnosis. In the left side, you can see main pathological processes and diseases of this situation. Acute transmural myocardial infarction, atherosclerosis of aorta, coronary artery atherosclerosis, thrombosis of atherosclerotic plaque, pulmonary edema, swelling of the brain, peptic ulcer in the remission. You must stay those pathological processes and diseases in the four main rubrics of diagnosis: underlying disease, background disease, complications, and concomitant disease. The next case, case number 3. Situation. Physical condition of the young woman suffering from the rheumatism has sharply worsened owing to disturbance of brain blood circulation. Soon the patient died due to autopsy. Cusps of mitral valve with presence of on edge of those cusps of red-gray masses. The cavity of the left ventricle is stretched. Thickened of its wall is up to 2 centimeters. In the substance of the brain, there is area of grayish color and flabby consistency, peppy consistency. In this photo, you can see anatomical changes in the mitral valve. Was the diagnosis of rheumatism in this patient true? Motivate this answer. Which clinical anatomical form of disease is found in this patient? Look, in this picture you can see anatomical changes in the brain. You can see changes in the substance of the brain. What are possible mechanisms of each development? Please stay the correct pathological diagnosis. In the left side you can see main processes and diseases of this situation. Rheumatism, active phase, acute varicose endocarditis, cardiovascular form of disease, cerebral artery thromboembolism, cerebral ischemic infarction, swelling of the brain, and chronic tonsillitis in the remission. You must stay those processes and diseases to the four main rubrics of diagnosis: underlying disease, background disease, complications, and concomitant disease. The next case, case number 4. Situation. The man eat mushrooms. Then vomiting, diarrhea, weakness were marked. Through the 3 days, there appeared pains in the right half of abdomen, yellow color of the skin. Through the 3 weeks, the patient died due to autopsy. The liver is reduced, has flabby consistency on incision with pleural dark red areas with blurred contours. Questions. In those pictures, in those photos, you can see histological examination of diseases in the liver. In the left side, first stage, in the right side, second stage. Which process developed in the liver and in what state of disease did the patient die? Look, in those pictures, you can see several pathological processes in the lungs, left side, and the liver, right side. Which processes can we see? Which color of the skin on this patient, and which mechanism of this color in the skin? Please think. At what other diseases is there a similar color of the skin? Viral hepatitis, atherosclerosis of the aorta, cirrhosis of the liver, stomach ulcer, cancer of the liver, pancreas cancer, myocardial infarction, hemolytic anemia, and post-hemorrhagic anemia. Please think. And stay the correct pathological diagnosis. In the left side, you can see main pathological processes and diseases of this situation. Mushroom poisons, acute renal failure, toxic degeneration of liver, pulmonary edema, swelling of the brain, and chronic alcoholism. You must stay those processes and diseases to the four main rubrics: underlying disease, background disease, complications, and concomitant disease. The next case, case number 5. Situation. The man of 52 years old, suffering from the gastritis, dies suddenly due to massive gastric hemorrhage. At the autopsy, in the cavity of stomach, there are found liquid blood about 1.5 liters. In pylorus, there is a defect of a round form in diameter about 3 centimeters with dense edge and which is penetrating up to the rose wall of the stomach. Bottom and edges of the defect consist of rough scar. A zone of necrosis is covered by fibrin and leukocytes. Questions. In this picture, you can see in the left side anatomical changes of the stomach, in the right side histological changes in the stomach. From what disease has the patient died? How was the defect in the stomach wall called? I repeat, in pylorus there is a defect of a round form in diameter about 3 centimeters with dense edges which is penetrating up to the rose wall of stomach. Bottom and edges of defect consist of a rough scar. Zone of necrosis is covered by fibrin and leukocytes. What is this? Motivate your answer. What is thought of the direct cause of death, and how is it connected to the general disease, to the underlying disease? What is the mechanism of hemorrhage in the stomach? Please think and state the correct pathological diagnosis. In the left side, you see several conditions, several pathological processes and diseases. You must stay to the right side to main rubrics of pathological diagnosis: chronic gastritis, arterial hypertension first state, peptic ulcer exacerbation state, gastric bleeding 1.5 liters, acute post-hemorrhagic anemia. The next case, case number 6. Situation. Young woman suffered from the pyelonephritis. After the treatment by antibiotics, oligoanuria has developed, and in 2 days anuria, azotemia, and edema. Therapeutic stimulation of the diuresis gave no effect. The patient died. At the autopsy, kidneys have weighed 370 grams. Cortex of the kidneys is of pale gray color, pyramids of dark red color. At histological examination, in the epithelium of proximal tubules, nuclei are absent. Questions. In those pictures, you can see in the left side anatomical gross section of kidneys, in the right side histological examination. Name the basic morphological substratum of this condition. To which clinical anatomical syndrome does it correspond? And state the correct diagnosis. In the left side, you must use main pathological processes: drug poisons, acute renal failure with oligoanuric stage, pyelonephritis remission. You must stay to main rubrics: underlying disease, background disease, complications, and concomitant disease. The next case, case number 7. Situation. In the man of 20 years old, the aggravation of disease was manifested in edema of face, body, pains in the lumbar area. An urea has developed. The patient died. At the autopsy, edema of subcutaneous fat, fibrinous films on the mucous membrane of intestine and epicardium, kidneys are enlarged, have flabby consistency, cortex is thickened with red hemorrhages. Medullary substance of kidneys has dark red color. Histologically, in the glomeruli, there is marked proliferation of cells of capsule with formation of semilumis. Single glomeruli are hyalinized. Question. In those pictures, you can see in the right side gross section of kidneys, in the left side histological examination. What disease has the patient? What is the result? Confirm it. What was the cause of death of this patient? Immediate cause of death in this patient. You can see gross section. State the correct pathological diagnosis. In the left side, you can see main pathological processes and diseases in this situation. Subacute extracapillary glomerulonephritis, acute renal failure with uremia, swelling of adipose tissue, fibrinous pericarditis, fibrinous enteroiditis, and tonsillitis in the remission. You must stay those processes to the four main rubrics of diagnosis: underlying disease, background disease, complication, and concomitant disease. The next case, case number 8. Young, physically strong man came down under the ice. He became ill sharply. The temperature has increased up to 40 Celsius, and pain in the chest has appeared. He died on the 6th day of disease. On the autopsy, left lung is solid, heavy. Surface of the incision has gray color, small granule. In the left lobe, a circular formation with a diameter of 4 centimeters, filled with pus. On the pleura, we see gray fumes. Questions. In those pictures, you can see anatomical examination of the lung and histological examination is the right side. What disease has the patient suffered from? What is state of this disease? Which morphological microscopical picture in the lung will be found to the pathologist? And please state the correct diagnosis. In the left side, you can see main pathological processes and diseases of this situation: swelling of the brain, pulmonary edema, lobar pneumonia, and lung abscess. You must state those processes to the four main rubrics of diagnosis: underlying disease, background disease, complications, and concomitant disease. The next case, case number 9. Situation: a man of 60 years old, the smoker, arrived to the hospital with a complaint about weakness, loss of body weight, cough with purulent mucus with the blood. During the bronchoscopy, the lumen of bronchial tube in upper lobe is narrowed. On mucous membrane, there is a plaque shape thickened with rough surface. Due to histological examination, in the biopsy, in the wall of bronchial tube, there are found focal congestion of a typical flat epithelium, which kept ability to keratinization. Questions. In those pictures, you can see in the left side anatomical picture and anatomical changes in the bronchial tube. And in the right side, you can see histological changes. What process is found in the bronchial tube? What is the version of according to the histological structure? What pathological process preceded the changes in the bronchial tube? Name the factor promoting development of disease in this case. And please state the diagnosis. In the left side, you can see main pathological changes, main pathological processes and diseases of this situation. Central squamous cancer with keratinization, chronic bronchitis, cachexia with intoxication. You must stay those processes to the main rubrics of diagnosis: underlying disease, background disease, complication, and concomitant disease. Thank you for your attention. Please, in the practical lessons, you must discuss those cases. Discuss with your teacher and state the correct diagnosis. If you have a questions, please answer those questions of your teacher. Thank you for your attention.